If your loved one is not dead, they are in the dying process, and this is just randomly happening, this is something you need to talk to your hospice company about. Now, I can say it's normal, and it likely is normal, and there's probably nothing we can do about it, but still talk to your hospice company. So number one, if it's happening and your loved one has not died, they are just having a bad day, or this just happened randomly, make sure you talk to your hospice company, see what's going on, see if there is something they can do about it. Two, you want to have chucks, which are basically bed pads. Bed pads will be helpful to have underneath your loved one. I think at all times on their bed, this will help with changing and cleaning things up. And also if they end up having some kind of bile come up, you have chucks to clean them off, catch the fluid, just an easy cleanup. I would always have bed pads or chucks, which hospice provides. I would always have wipes, so anything like a baby wipe. Now, some hospices provide those, some hospices don't. Technically, per Medicare guidelines, they don't have to provide wipes. But I think wipes, super convenient and easy to clean your loved one up if this happens. Your hospice company will also provide you with gloves. Now, sometimes you don't have the time to put the gloves on. I would always suggest putting the gloves on. Again, this is something that feels really scary, but is it really an emergency? Most likely not. It's most likely not an emergency. So although it's scary and not fun, you can take the time to put gloves on most likely. So I would put gloves on, which the hospice company should provide for you, and then proceed in cleaning up. The goal always being making sure your loved one is clean, safe, and comfortable. So you possibly can take your time to do these things, especially if they are comfortable. And just FYI for disposal, you can just clean this up and then throw it out. I would also take the trash bag and take it out of your house, put it in the trash can, just because there can be some smells. So one circumstance that can actually be scary and be alarming that we should talk about and know what to do if it happens is if someone has esophageal varices. This usually happens when someone has severe liver damage, usually with alcoholism, but it can be non-alcoholic liver disease. But varices basically develop in the esophagus and they can burst. And when they burst, the person will cough up blood. And a lot of blood. It can feel very scary and look very scary. And it is scary because they are choking and coughing on blood, their own blood. This is the one time in hospice that it is like, ooh, this is scary. Let's take some action right away. So one, call your hospice company if this is happening. And really,